right, now we're going to look at chapter 26, which is diseases of the urogenital system. So let's focus on the urinary system first. With the urinary system, we see that there are some structures present that deal with the kidney. The kidney is the functional unit of the urinary system that actually produces the urine. The urine then travels through the ureter. It then is stored in the bladder, which then will leave through the urethra. Now this leads us to a couple of places of inflammation that can take place in the urinary system. We have pyelonephritis. This is going to be severe inflammation of the kidneys. We have cystitis, which is inflammation of the bladder, and urethritis, which is inflammation of the urethra. Now there are some bacterial infections of the urinary tract. This is going to be a lot of times opportunistic bacteria that are from intestinal coliforms. So as long as they're in your intestines, they're fine, but if they gain access up through the urethra, it can cause some major issues. Now females are 8 times more at risk than men for this, and the reason for this is because of the close proximity of the urethra to the anus. We also see that this is very common in hospitals, the nosocomial, due to catheters. Symptoms include dysuria, which is painful, difficult, and urgent urination, and also what we call pyuria, which is pus and white blood cells in the urine, which causes it to be cloudy. Some diagnostic tests that can be done is using a urine culture with colony counts. These urine culture colony counts allow us to be able to see how much bacteria is present in the urinary system. There are different ways to collect this. We could use a catheter, but that's a little more invasive. You're not just going to want to go in and give a urine sample and have them collect it through the catheter. But a catheter could potentially give you a cleaner sample since it's going straight up through into the bladder. We see that most of the time what's used is what we call the clean catch midstream method, which is CCMS. This is where you start to go to the bathroom, and then in the midstream you collect the sample. We will see a difference in males and females because of the fact that in females the urine is going to come in contact with the outer portion of the skin and other structures, which then means it could be contaminated more compared to in males. We then can also do sensitivity testing, and this looks at what we call susceptibility testing. Treatment is normally with antibiotics. One of the examples is the Septra, and remember that the Septra is where we actually see a combination of the 2 different antibiotics used together. One reason we need to do diagnostic testing is this is going to help us be able to identify which antibiotics will be best to treat the infection that's present. Cystitis is going to be the inflammation of the bladder. Some common culprits for this are E. coli, Staphylococcus species, but not Staphylococcus aureus, Enterococcus, which is going to be a healthcare associated infection, and then also opportunistic coliforms. We also see pyelonephritis, which is the inflammation of the kidney with a kidney infection. The common culprit is E. coli, and this is because it can progress from the bladder to the kidney. Leptospira interrogans is what causes leptospirosis. Transmission here is in contact with urine and products of infected animals. These a lot of times are shed by dogs and rats, and this is a spirochete bacteria. This enters through abrasions in the skin. Symptoms include muscle aches, fever, and infection of the liver, but it can progress and cause damage to the liver and kidney and lead to kidney failure. Treatment here is antibiotics, and prevention is actually to immunize your dogs, since they are a common carrier that you would come in contact with their urine or other products if they were infected. One issue with this though is that the dog could shed the bacteria even after it is immunized for it. Now we're going to spend the rest of our time looking at reproductive system. Now we're going to spend the rest of our time in this chapter looking at the reproductive system. Now, when we look at the reproductive system, there is a big difference between males and females. Females have a normal microbiota, which is located in their reproductive system. One of the main organisms that's present is lactobacillus, and this gives the vagina its more acidic pH. However, in males, their reproductive system is virtually sterile. There should not be many natural microbiota present in their reproductive system. Now, the mode of transmission most of the time for the reproductive system diseases is sexual, and this is why a lot of times they were called STDs, or sexually transmitted disease. The problem with calling it an STD is that we think a disease has certain signs and symptoms. A lot of times when a person has an STD, they don't even know they have it. And so now that it has been renamed as an STI, which is a sexually transmitted infection. Prevention for STDs or STIs is abstinence. That's the only way, surefire way you don't get it, but then also the use of condoms. Treatment is through antibiotics, antivirals, or antifungals depending on what type of infection is present. The majority of these infections are reportable to the CDC in order to keep track of outbreaks and things like that in certain areas. So let's look at the bacterial diseases first. When we look at the bacterial diseases, we see that the first one is gonorrhea, which is caused by Neisseria gonorrhoeae. We also have non-gonococcal urethritis, or NGU. This is caused by Chlamydia trachomatis. We also see pelvic inflammatory disease, or PID, which is caused by the two above bacteria just discussed. We also see syphilis, which is caused by Treponema pallidum. We also see that we can have Lymphogranuloma venereum, or LGV, Chlamydia trachomatis. We also see that we can have a chancroid, or soft canker. This is caused by Haemophilus ducreyi, and then also bacterial vaginosis. So we're going to look at Neisseria gonorrhoeae first. This causes gonorrhea as well as pelvic inflammatory disease. This is probably the most reported infectious disease in the United States. Symptoms include urethritis, which it means it attaches to the epithelial cells of the urethra. This potentially causes painful urination. Also, a whitish discharge from the urethra. We see that 60% of the cases are in the ages between 15 and 24. Treatment is through antibiotics. The issue is that there are some resistant strands out there. One thing that allows it to be able to be more virulent is the way that it attaches to those epithelial cells, and it does this through fimbriae. Also, the whitish discharge is more noticeable in males than in females. Now, complications is going to cause potential complications of gonorrhea or pelvic inflammatory disease is it can cause sterility due to progressive scar tissues. In females, it can cause blocked fallopian tubes, which is the tube that allows transport of the egg to the uterus. In males, it can block the epididymis and the vas deferens, which are the tubes that deliver the sperm into the ejaculatory duct in order to then leave the penis. We see inflammation of the uterine tubes, the uterus, the cervix, and or the ovaries can take place, and this is known as the pelvic inflammatory disease. So it travels up and pretty much hits every area of the reproductive system in the females. We see that it also can cause infections of the rectum, the pharynx, the meninges, and also in our joints if it progresses to other. We also see that there is the neonatal gonococcal ophthalmia. This is going to be the infection in the eyes of the newborn. Prevention of this is through silver nitrate or erythromycin, and this is one reason they put that salve on the eyes when the baby is born, because it contains a lot of times the silver nitrate in order to protect it from this bacteria. When we look here, this is a gram-negative Diplococcus. It is fastidious, meaning it is picky. It does prefer the chenophilic type of environment, meaning high carbon dioxide and lower oxygens. It survives poorly outside of the body, so you need special transport and media in order for the cultures to grow. We see here that we can use the Thyromartin agar, which is a selective media. It also is oxidase positive, and when we look at it too, it is a glucose fermenter, not a maltose or sucrose, but it does prefer glucose. One thing about the Thyromartin agar is it's selective because it is also a chocolate agar that contains certain antibiotics. So with Chlamydia trachomatis, it can cause NGU and PID. The symptoms are gonorrhea-like with painful urination, frequency, and a watery discharge. Complications can also progress into PID. This is actually more common than in the normal gonorrhea. We also see that the onset is more insidious. It can cause sterility as well, more damage to the uterine tubes, increased risk of cervical cancer. This is normally due to a co-infection with potentially HPV. We see that it also can cause a neonatal chlamydial infection. Now, this can actually cause blindness in the child, and it can also cross the placenta and cause newborn pneumonia. Diagnostic testing is through special collection culturing techniques because these are also obligate intracellular parasites, and we have to do direct testing on the body fluids. Treatment is antibiotics, and the treatment of choice is tetracycline. A note here is co-infections with in gonorrhea are not uncommon. It can actually have both, which then progresses and causes those complications of PID to be more present. And this is especially true in females. So syphilis is caused by Treponema pallidum. This, when we look at syphilis, it undergoes several stages in its infection. We see that this is a spirochete. The spirochete gives a spiral shape. The primary stage of this infection is where there's an onset about 3 weeks following exposure. The symptoms are normally a painless, hard raised chancre, and it becomes crusty. The diagnostic test here is to look for the movement of the spirochete. All right, so we're going to have to actually be able to take the culture and look for the movements of the spirochete. Treatment here is penicillin. It then could progress to the secondary stage. This non-sexual transmission now is possible once it enters the secondary stage. This onset is several weeks after the primary stage. Symptoms include a skin rash, like pox-like regions over the body, hair loss, a mild fever, and it subsides after a few weeks. Treatment is successful also at this stage with penicillin. We then have the latent stage. There's no symptoms here. It could last up to 2 to 4 years. It may be transmitted from mother to fetus at this point, and this is also known as congenital syphilis. We then can see the late stage, which is the tertiary stage. There's a small percentage of individuals that this progresses to that tertiary stage. This is going to happen many years after the latent phase. Symptoms are going to be an immunological reaction to it. This can cause rubbery masses, or what we call gummus, on the skin. It's most common on the skin. It may affect the nervous and cardiovascular organs as well, and this can result in tissue or organ damage. Treatment here is not always successful because it's already progressed into this very late stage, and so treatment is not always going to be successful because damage is already done. In this case, guys, it shows you the picture of on the skin. It also shows you an aortic aneurysm where the lining of the aorta is starting to thin, which causes a bulge which could rupture, and then also showing you the damage that's happening to the brain. There are serological tests available. We see that we can do Venereal Disease Research Laboratory, or VDRL. There's also the RPR, which is the Rapid Plasma Reagent. We also have FTA-ABS, which is the treponema antibody. These are all ways that we can test serologically for syphilis. We also see that there is the premarital testing, but this is antiquated. Used to, whenever you were going to get married, you would have to do premarital blood testing, and syphilis was one of the things they were looking for. Now this is not done. The incidence is declining of syphilis, but the at-risk population are these socially, economically disadvantaged individuals. The next one is Lymphogranuloma venereum, or LGV. This is caused by the Chlamydia trachomatis. This invades the lymphatic system. It is rare in the U.S. It is common, however, in tropical areas. Symptoms include lesions and swollen lymph nodes in the groin area. Treatment is antibiotics. We then see the chancroid, which is a soft canker. This is caused by Haemophilus ducreyi. This is a fastidious small gram-negative rod. When we collect it in body fluids, it does show a streptobacillus structure. We see symptoms include swollen, painful ulcers on the genital organs, and it does infect the lymph nodes, causing them to swell. This goes underdiagnosed and underreported. However, treatment is antibiotics. Now, it is not very common for this to be seen in females because since it is going to cause these ulcers on the genital organs, it's going to be more internal and harder for them to be detected and seen. The next group is bacterial vaginosis. This is caused by Gardnerella vaginalis. This is a tiny paleomorphic gram-negative bacillus. We see that it is opportunistic. Predisposition is due to antibiotics. This can destroy the normal lactobacilli, which normally outcompetes this, and it can then be present. Diagnostic test is to do a KOH prep. When we do a KOH prep and we put the potassium hydroxide, it actually has a fishy odor smell to it. We also are going to look for clue cells and also the frothy discharge. Treatment is going to be antibiotic flagyl. So when we take a look here, we can see that there's the frothy discharge present. We would also see that we could do a wet mount where we can look for clue cells. These are epithelials packed with bacteria, and so it shows you the top ones are the abnormal, whereas the bottom ones are normal. We could also do a pap smear as well. Now we're going to take a look at the viral infections. These include the genital herpes, herpes simplex virus type 2, genital warts, which is the Papillomaviruses, HPVs, and then AIDS. This will actually be discussed more in the immunity unit, which is the last unit here. So with genital herpes, this is going to be herpes simplex virus type 2. This is a DNA virus. It's the same virus that causes cold sores, and this is normally what we call herpes type 1 in the mouth. Symptoms are painful ulcerations and fluid-filled vesicles, but these are found now on the genital organs. Once you have it, you always have it. There's a lifelong latent stage with reoccurrences that can happen. Transmission to a newborn via the birth canal can take place. This can cause blisters due to what we call congenital herpes on the baby's skin. It is also capable of crossing the placenta. The treatment for this is an antiviral, which is called acyclovir. Acyclovir is used in order to hinder viral replication. Now we have genital warts. This is the papillomavirus or HPV. This is also a DNA virus. This causes cauliflower-like warts that are smooth and flat with finger-like projections on the skin. There are a few serotypes linked to cervical cancer in females. Treatment is excision of the warts, taking them off, but there is no cure. There is prevention with some vaccines, but these vaccines only target 4 of the serotypes, which are linked normally to the cervical cancer. All right, the last little bit here, we're going to focus in on the fungal and the protozoan infections. With the fungal group, this is going to be caused by Candida albicans. The protozoan is going to be caused by Trichomonas vaginalis. We look at Candida albicans. This is an opportunistic yeast. It is polymorphic. We see that there are some predispositions if individuals are taking antibiotics, again, due to the normal flora being taken out. This can then outcompete them. Pregnancy, contraceptives, and also individuals who have diabetes. Symptoms are similar to thrush lesions that are normally located in the mouth. However, this is going to be in the genitalia region. This causes severe pruritus, which is itching. It can also cause a yellowish, cheesy discharge. The diagnostic test is to do a wet mount of the vaginal discharge, and then also we can use a culture. Treatment is through antifungals. These can be over the counter. Some examples are the chlorotrimazole and miconazole. So we take a look here with the vaginitis test with the wet mount. You take a sample of the vaginal discharge. It's taken and put on a slide for the examination. So with the wet mount, we can be looking for the structures here where it's going to have more of the filamentous or the yeast-like structure. We can also then culture it as well.
Trichomonas vaginalis.
Now with Trichomonas vaginalis, this is a flagellate. It grows along the mucosa of the reproductive tract. The diagnostic test here is going to be a wet mount of the discharge or the urine, because in males it would be the urine, the discharge in females from the vagina. So males can also carry this. It just obviously doesn't cause inflammation of the vagina since they don't have that. We see that it can be asymptomatic, and this is what you normally see in males, but it can cause internal discomfort, profuse yellow discharge, and a foul odor. The treatment here is the antibiotic flagyl. Now, since this is a protus and it is a flagellate, you do have access here to a YouTube video that shows you the movement, and this is one reason why you would do the wet mount in order to actually see the motility of this organism. All right, so this gives you a little bit of coverage over the urogenital diseases. If you have any questions or concerns, please let us know.